Female genital schistosomiasis complications. Definition: a clinical apparent vulval, vaginal, and cervical schistosomiasis is a common gynecological finding in areas where infection with schistosomiasis haemotobium prevails. However, as a disease entirely female genital schistosomiasis has been neglected during a period when considerable progress has been achieved in almost any other field of schistosomiasis research. Now the video. Now, applications in medicine. Theoretically, the natural history of eggs, decisions of the female genital tract should be of chronic nature. In experimental schistosomiasis maxon infection, the typical egg granuloma in the liver reached its maximum size by 4 to 8 days. However, total removal of residual eggshells require at least 3 months, and if eggs calcifies, probably years. Accordingly, the anatomical and/or functional abnormalities engaged by granuloma and subsequent scar formation should be extended over a similar period of time. Pros and cons. Genital manifestations of schistosomiasis Manzoni infections have been neglected as a disease indeed during a period when considerable progress has been achieved in the diagnosis and management of other disease complications such as liver fibrosis.
I have worked for many years on schistosomiasis, and it's a relatively recent phenomenon that we've realized just how much the female genital system has been involved as a result of adolescent and even younger girls getting infected with urogenital schistosomiasis, schistosoma hematobium. And as that infection has proceeded over the years, eggs from the worms that have supposedly left the human body in the urine, having gone through the bladder, have actually ended up in the cervix.
Yeah, issue applied in Ecuador. In practical, through the natural evolution of egg-induced lesions is almost unknown. In patients whose records have been published, the natural history has been interrupted by surgical interventions, which in the case of impreviously sized pelvic tumors of putative malignant origin seems to be justified. However, whether in young women with cervical schistosomiasis hysterectomy is appropriate therapeutics means.
yo de infecciosas del Hospital Vallegrán, hace una colaboración de hace unos 10 años con un hospital de Angola, y en esta colaboración pues ha habido bastante.
In conclusion, that migrating worms are actually responsible for the deposition of eggs in ectopic organs rather than a mere embolization of passively transport eggs to aberrant sites is clearly evidenced by the identification of copulating adult worms in histological sections of internal genital organs.